Today, we celebrate the 50th anniversary of our great union. Before nurses in our province were unionized, we were paid a pittance. We had no health insurance or pensions, schedules were posted just 6 days in advance, and we had every fourth weekend off. We were not treated like healthcare professionals. Since our union was founded in 1974, we have negotiated better wages, improved pension plans, health and disability benefits, family leave, maternity leave, a 37.5-hour work week, better working conditions, and the right to practice to our full scope. Only 3 times in our history have we had to resort to the picket line. Every day, we defend our contracts and stand up for the rights of individual members. We advocate for the public healthcare system and the rights of patients, clients, and residents throughout Newfoundland and Labrador. Today, our UNL represents some 5,800 registered nurses with 250 nurse practitioners. Together, we can help shape the next 50 years of progress for nursing in our province.
I love a lot of things about being a nurse. I love getting to connect with patients on a deeper level, hearing where people are from, their stories, beyond what brought them into the hospital setting in the first place. I enjoy getting to care for people in their most vulnerable, as well as their most memorable situations.
I think what keeps me there is my patients. You can't always make things better, but I think being able to be there through the worst and the best, and just being able to be that person that can help and that can make a difference.
Nursing is a rewarding profession. The care that you provide to your patient and the care that you provide to a family, that can make a difference to someone for the rest of their lives.
The union welcomed me to the profession when I first started by sending me a member handbook. This outlined who the union is, what the union does. It gave me a better sense of branch executives, shop stewards, my points of contact, so I was better prepared and knew who to go to and what to do going forward.
Our union is very supportive of its workers. If you need anything, is a way to reach out and you get a response usually within a short amount of time.
The difference in pay from when we started, or when I started, and to now, it is a significant change. And I feel that that's been solely through collective bargaining.
Our last collective agreement was a very good agreement that we negotiated. We've also done the travel locum premium up in Labrador, northern Newfoundland, where there's an extra incentive of $25 an hour to go work in her to recruit communities.
The nurses union is there to protect you. It's there to support you. There's a lot of resources available, fair negotiations, constitution, policy.
We're working on a lot of stuff with violence, which is becoming a big concern with the union right now because violence in the workplace is unbelievable.
Violence against nurses is a very big issue that we face in the nursing profession, hence why we are advocating for resources such as an independent health sector safety council.
You feel like you're protected. You feel like you have backup. You feel that you're not out there alone.
There's going to come much challenges that you meet in the workplace. Having access to support, to labor relations officers, shop stewards, representation in the workplace, it all helps in terms of creating positive change and making sure that you are protected in your profession.
I think without the union we would be in a lot of trouble. I don't think we would have any nurses to work at all. I think that it would be a very poor career choice if you didn't have a union to back you up.
The union's involvement in my career is so integrated into my practice and my experience. I couldn't visualize my career without the union being involved.
One thing I would like to say to all registered nurses and nurse practitioners, that through the Registered Nurses Union, we are all together. There is strength in numbers, and at the end of the day, we have each other's back.
When a patient comes up and says thank you, or a family member comes up and hugs you and says thank you for everything you did for my loved one or myself, that's what makes everything I do worthwhile.